Governor Huntsman, name 3 areas where Americans will feel real pain in order to balance the budget.
Well, I would have to say that I agree with the Ryan plan. I think I'm the only one standing up here who has embraced the Ryan plan. It's a very aggressive approach to taking about $6.2 trillion out of the budget over 10 years. And it looks at everything. And what I like about it is it says there will be no sacred cows. Medicare won't be a
same question. 3 programs that would have to be cut to make Americans feel pain, to sacrifice if we're going to balance the budget.
I would agree with Governor Huntsman that means testing. Food stamps is another place. We've got a block grant and send it back to the states, just like I did on welfare reform. Do the same thing with Medicaid, those 3 programs.
Speaker Gingrich, on the issue of Medicare, when you were on Meet the Press earlier in the year, you had talked about what Paul Ryan was talking about as a step too far, which is moving seniors onto a premium support or a voucher program, depending on how you phrase it. As you know, Senator Santorum thinks that current seniors should be moved off of that program into premium support or a voucher program. Do you agree with doing it that quickly and making current seniors bear the brunt of that?
Well, the fact is that the Ryan-Wyden bill, which was just introduced recently, actually incorporates allowing people to choose and allows them to stay in traditional Medicare with the premium support model or go to new methods. And I think it's a substantial improvement because it allows for a transition in Medicare in a way that makes sense.
Paul Ryan, Senator Santorum, had a plan where he'd like to move seniors off, give them a voucher or premium support, and then they would take care of their health care from there. There's a lot of debate about that, and I mentioned, you said, seniors should be affected right now, 55 plus, have them affected right now, which has been somewhat controversial. You wanted to respond to that.
Well, you know, I hear this all the time when I've been campaigning around the state. You know, we should have the same kind of health care that members of Congress have. Well, that's pretty much what Paul Ryan's plan is. The members of Congress have a premium support model. So does every other federal employee. I mean, it works very well. As you know, the federal government has a liability. They put money out there, and then if you want, you have about this thick. If you're an employee in Washington D.C., you've got a whole bunch of different plans to choose from, and you have all sorts of options available to you. If you want a more expensive plan, you pay more of a co-insurance. If you want a less expensive plan, you don't. But here's the fundamental difference between Barack Obama and everybody up here. It's whether you believe people can be free to make choices or whether you have to make decisions for them. And I believe seniors, just like every other American, should be free to make the choices in their health care plan that's best for them.
We've got to stop the extraordinary spending in this country. That's why I put out a plan that reduces government spending. I cut programs, a whole series of programs. By the way, the #1 to cut is Obamacare. That saves $95 billion a year. Return, just as Rick indicated, return to states a whole series of programs, food stamps, housing vouchers, Medicaid, and then set how much goes to them. And finally, with regards to entitlements, in the entitlement reform area, I do not want to change Medicare and Social Security for current retirees. But for younger people coming up, they have to recognize that in the future, higher income people will receive less payments of the premium support program.
Senator Santorum, when you voted for a new prescription drug benefit that did not have a funding mechanism, were you advancing socialism?
Well, I've said repeatedly that we should have had a funding mechanism, and it's one of those things that I had a very tough vote. As you know, in that bill, we had a health savings account, something I'd been fighting for 15 years to transform the private sector healthcare system into a more consumer, bottom-up way of doing it. We also had Medicare Advantage to transform the entire Medicare system into Medicare Advantage is basically a premium support type model.
Were you advancing socialism, though?
So,
that's the point.
I think I'm just answering your question. Maybe we're not communicating well, but I just talked about the medical health savings accounts is an anti-socialistic idea to try to build a bottom-up consumer-based economy in healthcare. The same thing with Medicare Advantage. And we also structured the Medicare Part D benefit to be a premium support model as a way of trying to transition Medicare. So there were a lot of good things in that bill. There was one really bad thing. We didn't pay for it. We should have paid for it, and that was a mistake.